Hello everyone, welcome to this month's Team Brief. I'm James Thomas, the Director of Operations for Plan Care, and I led our meeting this afternoon. This month we talked about the staff survey and the need to get our responses back by the 8th of December. Please do pass the message on to your teams as the responses are really important. Secondly, we talked about flu vaccination. We're making really good progress this year. Already in just 4 weeks we've vaccinated 30% of the organisation, but we still have got a long way to go. So please do get your teams to take up the offers of vaccination across the Trust. Thirdly, we talked about our new recruitment. This week we were delighted to welcome Noreen Moss and Christine Armitage to the roles of Associate Directors of Operations for Task and for Medicine. And lastly, we talked about performance. We're achieving really well in some key performance areas. In terms of 18 weeks, we've consistently met the standard, and in terms of cancer, we've met the key standards for 9 months now. We are well above the national average. And in terms of our A&E performance, although we're below the mandated minimum, we are in the top third of trusts in terms of A&E performance. One of the key presentations we gave today was around our work on our vascular transformation. A number of specialist services such as vascular need to do a minimum number of cases every year and need to have a certain size catchment population. In terms of our vascular population, we have around half of what we need. Therefore, at the moment we're looking to work with a partner who can help us in a network arrangement run our services in a sustainable way. Currently, we've received bids from a number of provider trusts who want to work with us, and we're working through those to see how we can take this partnership forward. The timeline we're working to is to work with a smaller number of these potential partners so that in the new year we're ready to take a business case to our trust board with a preferred provider and preferred model. In our second key presentation of the day, myself and Alicia Wood, Service Manager for General Surgery, talked about ERS. ERS stands for Electronic Referral System. It completely removes paper from the way we receive referrals from primary care. This is going to have big implications to us in the way we work and the way we manage referrals. By October next year, we won't actually get paid for any patients that we see that are referred by paper, so it's really important that we're ready for the full implementation of this new process. There are a number of benefits to this. It's quicker for the patients, there's less administration for ourselves, and it's quicker and less onerous for our clinicians when it comes to receiving referrals.
As a service manager, ERS means that I have to work differently with my clinical colleagues in order to provide capacity for patients to be booked into. The next stage in ERS implementation is that I'm now working with my clinicians to remove the need for clinical triage before the patient's appointment. Myself and other management colleagues are working to roll out ERS across all specialties throughout the Trust, including our cancer specialties.
We've made a lot of progress on ERS in the last number of months, and currently we're receiving 8,000 referrals a month through our ERS programme. And we are actually one of the top performers in the region and nationally in how well we're implementing and operating our ERS system. Our last presentation was from our chairman, Andy Field. He's been here 2 months now, and he shared his reflections of what it's like to join the Trust, what the chairman does in the organisation, and also answered questions from members of the team. He also shared the video that he filmed with Suzanne a few weeks ago. If you haven't seen it, you can look it up on the intranet or the Trust's YouTube channel.